started. Hello and welcome. Again, it's so good to see you all. I'm Angie Pilgrim. I'm the Director of Community Impact for the St. Croix Valley Foundation. And once again, I thank you for joining us over the lunch hour on this, as I mentioned, bright, beautiful day. I'm fairly confident that spring has finally arrived, but I've been wrong before in the Midwest, so I shouldn't jinx it probably. So on behalf of the St. Croix Valley Foundation and our longtime partner and event sponsor for State Bank and Trust, I'm happy to welcome you to the fourth and the final presentation in this year's Conversation of the Valley series. A quick reminder, the mission of the St. Croix Valley Foundation is to enhance the quality of life in the St. Croix River Valley by supporting charitable giving, connecting people and programs, and encouraging collaboration. And these Conversations of the Valley are one way that we encourage collaboration, bringing together individuals and organizations to learn and to imagine how we might respond to those current and those emerging issues that are appearing in our beautiful valley. So this year's series, as you know, we've been exploring regional resiliency. And that word, resiliency, is one we've all heard and used quite a bit over the past 2.5 years. So this year's COV program has dug into that word a little bit more. What does it mean when we're talking about our specific communities and our region? And what opportunities may exist that we can address to be sure our communities are stronger when faced with future challenges? So a quick recap of the series so far. We've had 3 sessions. In January, we heard from Professor Steve Deller from the University of Wisconsin on the many elements that contribute to building resilient communities. And he reported that 2 factors really stand out when it comes to resiliency: economic diversity and social capital. Those relationships, that networking. And then in February, we heard from Professor Tessa Conroy, also from the University of Wisconsin, and she presented the importance of entrepreneurs to a community's economic resiliency. And once again, she hit on that social capital aspect, community support, the strong social networks that are crucial to building small businesses and making them successful. Then in April, we heard from Heidi Swank from Rethos, and she presented their many programs that focus on engaging the community to inspire community resiliency, including the Main Street program that's nationwide. And finally, today, we will learn more about childcare's role in community resiliency. And when the planning committee first started meeting to plan this series, I spoke with an economist who said, and I quote, "Childcare is a very sticky problem right now and very important. Simply put, the business model is broken." So she really encouraged us to include this topic, stressing that our communities need to understand the depth and essentially the urgency of this issue. So that's why we're all here today. So before I introduce our speakers, we asked a few local community leaders, so why is early childhood care and education important to a community's resiliency? And what resources are available for parents with young children? So let's hear what they had to say.
My name is Agnes Ring. I'm Executive Director of Family Resource Center, St. Croix Valley.
Hello, I'm Mark Tyler. I'm chairman of OEM Fabricators and founder of Family Friendly Workplaces.
My name is Sherill Summer, and I am the director of the Larsen Family Public Library in Webster.
My name is Betsy Biker, and I am the Success by 6 director for United Way St. Croix Valley.
We have the privilege of working with families of prenatal to preschool children. Babies born during the earliest days of the pandemic will soon be 3 years old. We're inspired by the resilience demonstrated by parents and families who faced the challenges of bringing home an infant, in addition to all of the isolation, economic, and social challenges that came with the pandemic.
When I think about how does early childhood education and childcare affect resiliency of communities, I have to go to demographics. We are falling off a cliff in terms of birth rates in Wisconsin and across our country. And so it's critical that every child is successful. If every child isn't successful, we will not have the workers to support our communities in the future. Getting an early start, reading to children and making sure they have the right nutrition and the right environments to become as successful as they can possibly be, that's critical in how our communities thrive in the future.
But the library would not be what it is without the vital, dedicated users of the library that appreciate it, that give back to it as volunteers or give financial support. So many of these dedicated users are newcomers that are looking for a community, library community, and they're grateful for the community they find, and they don't take the community for granted, and it shows. So it works out well. The library has a mission to serve the community, and the community it serves gives back to the library.
For the young child, particularly in the first 3 years, we have an enormous opportunity as caregivers and educators to have an impact on that child's life. This is a time in a child's life when 80% of their brain growth happens. So there is an enormous opportunity to affect the child's social emotional development.
We work closely with 5 hospitals to provide parents of newborns with welcome baby visits that provide an early opportunity to identify needs for resources and support.
Our Family Resource Center in the St. Croix Valley is an incredible resource to help parents understand what's the best way to raise a child, what are good practices, what are not. Parents need help, and organizations like the Family Resource Center, Success by 6 with United Way. These are resources that are critical, for our region to help support families raise successful children.
I am the director of the Larsen Family Public Library, and certainly I'm working hard to make the library a welcoming community resource for everybody. And yes, that means the library itself is a community asset that adds resiliency.
This is an opportunity as well in these first few years that research tells us we can have an effect on both the mental health and physical health of a child. And I see that as a community's responsibility to respond to the needs of our youngest community members. We also know that parents have the opportunity during these early years to build resilience as well. Parents who feel supported by their communities will say that my community is helping me to raise my children. Parents who feel supported by their community feel as if they belong, that all families belong in this community. And that is how community resilience is displayed.
As part of our work with family-friendly workplaces, we really work with organizations, employers, to up their game when it comes to supporting families. So not only in benefits, but flexibility, sharing resources, providing information about where those resources can be tapped. These are important issues, and family-friendly workplaces works to help employers navigate that. We certify those organizations that are stepping up and providing better than market benefits and policies to their employees.
I am a longtime resident of Burnett County, and I am inspired by the community around me. A healthy community is able to bounce back. It has resiliency, and the organizations it supports are able to withstand adversity as well.
I also think it's really important to remember something that I learned through my many years as a parent educator and as a home visitor, and that was that growth and change do not happen outside of a relationship. And I feel as if that's probably very true for building community resilience as well.
Wonderful. Well, a huge thank you to those important partners, Agnes, Mark, Sherill, and Betsy. So we hope today's session will raise awareness and spark ideas and connections. And we invite you to reach out to the St. Croix Valley Foundation or one of the partners that's with us here today to understand how you or how your organization can be a part of this important conversation. A quick reminder, you are muted and hopefully will stay that way, but we will have time for questions at the end. So please type those questions into the chat box, which can be accessed, of course, at the bottom of your screen. And now I am pleased to introduce our two speakers. First of all, Kari. Kari is a business development consultant with First Children's Finance. Kari has been working with children and families for over 20 years as a childcare program owner, advocate, and early education leader. Kari's education in child and family studies, adult education, and master's in business administration provides her with the knowledge to support all aspects of a childcare business. Over the past 4 years with First Children's Finance, she has worked with hundreds of childcare entrepreneurs and community leaders to understand how supporting the early care and education field not only supports these small businesses and the children in their care, but also the overall health, well-being, and economy of a community. So that's Kari. And then Renee is the Director of Childcare Partnerships. Our partnership, she has worked for the agency for over 20 years in various positions, promoting positive outcomes for young children and their families in 10 Western Wisconsin counties. Her current focus is on connecting families with childcare services, developing childcare professionals, and collecting data that informs and impacts our communities. Renee works to develop solutions to the complex childcare challenges in this service area. So welcome to both Renee and Kari. Renee is actually joining us from Washington, D.C., from the airport where she's been busy advocating on this topic. And Kari from Detroit Lakes. So I turn it over to you two.
Thank you so much, Angie. If we could have you share the slides for us. I'm still having some tech issues on my end. We had a beautiful thunderstorm last night, and it has wreaked a little bit of havoc on my internet, and Renee is in DC. Thank you so much. Renee, do you want to say anything to kick us off?
I just want to say good afternoon, and that I will try to make sure that there isn't too much airport noise when I speak. We'll see what happens here. So sorry about that. But I thought it was super important when I was asked to do this advocacy that I should do it. And so we just spent a whole day with 5 different representatives of Wisconsin discussing childcare. So we're pretty excited about doing that work, and we should kick it off here. And I'll see if I can't just add when I need to, if the airport allows me.
All right. Oh, thank you so much. If you want to go to the next slide. Thank you. Well, I am so excited to be here with you today. Watching my screen, I'm seeing a few of my core team members from some of the communities we've had the privilege of working with in Wisconsin, and a few names over in Minnesota as well. So at First Children's Finance, we have been working on the supply and sustainability for over 30 years. We started in the metropolitan area of Minnesota, and we really believe that to make change for childcare business and for the childcare field, we need to work on 3 different levels. And that is working to partner with childcare businesses to strengthen their operations and achieve their dreams. So we have the privilege of training and providing consulting with childcare business owners in Wisconsin and in Minnesota, to help them really understand their business. One thing Angie mentioned is that business model is broken, and we need to support them to really understand how the nuances of ratios and finances impact their business. There aren't too many childcare business owners that I know. I've met a couple that got into childcare after having a business background. They get into the field because they love working with children and families. So we want to support them in understanding their businesses. We consult with communities in programs such as Dream Up, which we are doing in Wisconsin, and our strategic supply building program, working with communities across the state to understand how they can better support childcare businesses within their communities. In Minnesota, we have our Rural Childcare Innovation Program and our strategic supply plan as well. And then we work to influence and change public systems through partnerships, expertise, elevating childcare in policies, practices, funding, and plans, because we know that the policies that are in place are important to keep children and providers safe and growing and developing within those childcare and early education settings. But those policies have impact on that bottom line for our childcare businesses as well. So we try to inform and help understand what that looks like. I'm going to move to the next slide. So access to quality early care and education is vital to individual productivity and regional economic growth. We know that when parents have great places, high quality places to bring their children every day, they are much more productive in the workforce. It is hard for a young parent, to drop a kid off when they don't feel comfortable where they're at, but sometimes it's their only choice, because if they miss another day of work, they may lose their job, and that's just not an option for them. Those early care and education settings are developing tomorrow's workforce. It's crazy to think, but in just 12 to 14 years, those little babies that are in care today are getting their first jobs as babysitters, mowing lawns, and their experiences in their early care are helping them to understand how to resolve conflict, work together, build teams, read and write, and all of those other foundational skills. And we know that there is a high return on investment. Some studies show it's up to a $17 to every $1 invested in early care and education, because those children and families are able to thrive. They are able to get the resources that they need, the early intervention services that help them to be more productive children and adults. And we really know that by providing that foundation for young families, it just helps through a lifetime of higher quality experiences. You want to go to the next slide?
All right, so this is a map of Wisconsin showing the resource and referral agencies throughout. We cover all of the counties in Wisconsin. I would be Region 3, Polk, St. Croix, Pierce, Dunn, Chippewa, Eau Claire, Buffalo, Trempealeau, and Jackson County. So we covered 10 of the counties, pretty much the I-94 corridor to the Twin Cities. Wisconsin's childcare resource and referral agencies have been working alongside Children's First Children's Finance in the Project Growth is what it's called, between Partner Up and Dream Up. Childcare Partnership works with parents, providers, and communities to develop highly competent children through quality early childhood programming. We're a member of Supporting Families Together Association. That's Wisconsin's statewide network. And as you can see, I'm Region 3. We are the local solution for childcare programs and parents. Our staff work to connect families to accessible, affordable, quality childcare. And we maintain a database of regulated childcare programs. I'm sure you realize how difficult it is to find childcare. So our staff does have quite the interesting jobs, most recently really trying to support families and support communities to try to figure out the issues that we're having. So some of the things that we do, we hold monthly recruit sessions for potential providers to learn about the different types of regulation, take steps to open a childcare business. And then we also offer the entry-level courses that a potential provider would need to become regulated or to teach in a childcare center. We offer business startup and expansion consultation to new businesses entering the field and pre-licensing assistance to prepare family and group early care and education professionals for the state licensing process. This is done through technical assistance and childcare. We look at childcare environments, we look at policies, we look at procedures, staffing strategies, and all kinds of safety measures so that people are really ready to become licensed and to run a really quality program. Consulting and best practices, also we have staff that does that, and also training. So we're just out there trying to really make sure that the quality of childcare is at the highest that it can be, and be sure that children are getting what they need to be successful. Can move the slide.
All right. So Dream Up, as I mentioned before, is the project we are working with communities on, the strategic supply planning, where they are a team of community stakeholders is working together to understand the childcare needs within their defined community and working with local programs to expand the childcare supply within their areas. We are currently working with 28 communities across the state of Wisconsin, and are just finished up the application round, and we'll be announcing another 9 communities later in the month of May. Through that, childcare programs are also able to participate in a business leadership cohort, and those childcare programs receive a $5,000 stipend if they are located in one of those communities and complete our business leadership cohort. So that's some really exciting things that we are doing in the state of Wisconsin right now. Move to the next slide.
All right, so Partner Up, this is that public-private partnership that perhaps you've heard about. It's super exciting, and part of the reason why I'm in Washington is because people really did want to hear about this exciting thing that's happening in Wisconsin. I'm hoping there's not, is there a lot of background noise? We're okay? Okay, good, because there's a lot of background noise. Okay, the Partner Up grant program, it provided $21 million worth of funding to support partnerships between businesses who purchase slots at existing childcare providers. Participating businesses secured childcare slots in local programs for their employees' use. The employer contributes 25% of the true cost of care, and Partner Up contribute the remaining amount to pay the childcare provider. One factor that makes this program so successful at solving the childcare crisis is that the provider paid the true cost of care. And I'll explain a little bit about true cost of care. If an infant slot costs around $1,000 to $1,200, true cost of care is closer to $1,800. And so when providers are paid at the true cost of care, they can pay their employees more money. They can perhaps offer a benefit or two, things that are luxuries basically right now in the childcare field. Participating in the Partner Up program increases the revenue for the program, allows them to pay that livable wage that I mentioned, and it's really a model that we can build from and continue on. The problem that we're finding is, of course, that it's rooted in pandemic funding and needs ongoing investment and to sustain it. And that's exactly why I'm here to talk more about this. People across the nation are super excited and really interested in Wisconsin right now. This is one of the only states that has taken it on in this manner. Michigan has one, but it doesn't look at true cost of care. It only looks at market rate. And so right now we are really like cutting edge. And we're actually being asked to be in a pilot that looks at how we work with workforce development. And so we're just really excited that Wisconsin is so innovative in doing things. So the strategy has helped address some of the most immediate needs in Wisconsin's childcare infrastructure to keep programs open, assist parents in maintaining employment, and support the regional economy. And we can press the next slide.
So the information found here, I just wanted to share a couple resources with you all on that childcare need. Both Minnesota and Wisconsin have websites. Minnesota has the ruralchildcare.org website, where First Children's Finance actually does a research project each year on the number of slots needed for childcare in each zip code. And then Wisconsin has the sandbox data found on their website, the DCF Sandbox Data 2 webpage. So if you take a picture of those, you'll be able to access those websites. But it shares that childcare desert. What is that need? In pretty much every area in Minnesota and Wisconsin, there is some type of childcare need. And when we're talking about a childcare desert, that means there's 3 childcare slots or children for every 1 childcare slot that is available in that area. So if you want to find a little bit more information about your specific zip code, both of these websites are a great resource for you. Go to the next slide. We've talked a little bit about that childcare business model. And one thing that's unique, and oftentimes when we're talking with professionals outside of the childcare world, they take a basic tuition rate per child. They do some quick multiplying as to what that might look like for an annual income for a childcare facility, but don't take into consideration all of the nuances that go into running and operating a childcare program, like the ratios. So with our infants, we have 1 teacher for every 4 children. So this is a 104-seat childcare center example here. It is using the 75 percentile rate, and this is a market rate in Minnesota. Wisconsin and Minnesota are very similar in how much they charge for childcare and their ratios. So although this example is specifically for a county in Minnesota, very, very similar outcome at the end of the day for a childcare business. Startup costs of only $400,000 with $300,000 in rent, paying staff $12 to $16 an hour, and a director $20 an hour. Remembering that these staff need to have a college education at that teacher and director level, or some type of higher education and experience, and they're only making $16 an hour. This program will lose $34,000 a year. They need 95% occupancy to break even, which for most childcare programs, 95% occupancy is not realistic because kids get older every single day. So they have to move into that next ratio. And so we got to hold a spot open for a little while. Otherwise, you're kicking a kid out in a different age group. And there's different nuances there. So I think it's just valuable to look at a program like this. Is just an example. A 104-seat center can absolutely be viable, but we need a director that really understands their finances, ratios, staffing, and different things so that they can maintain their facility. That's where you all can come into play as partners for our childcare facilities, advocating for them, for partnerships and other ways that we can support those childcare facilities. You go to the next slide, it's another example. It's a little bit smaller of a child care center. But again, without having that true cost of care that Renee mentioned, we can't have a viable childcare facility. This one actually loses $102,000 a year. Again, we can be very mindful in our finances and our ratios and our teaching staff. But it is not an easy business model to sustain without partnerships, without community investment, and without, some really great low rent and those kind of things for our childcare facilities.
So here we're looking at the childcare workforce impact. And, as Kari mentioned, staffing cost is 80% of the provider's expenses. Yet 1 in 5 of Wisconsin childcare educators are worried about food insecurity. 1 in 2 are using at least one form of public assistance nationwide. 3 in 4 of Wisconsin childcare educators say it's extremely or somewhat extremely difficult to live on their household income. And so this is like, the issues that we're seeing is that people are just not staying in this field for very viable reasons, right? We have to be able to feed our family, and we have to have some healthcare and things like that. So it's really tough to keep people in these jobs. Only 1 in 5 of center-based teachers receive health insurance through an employer. In Wisconsin, more than a quarter of center-based teachers are reported that they are on public assistance in Wisconsin. Also, 27% of teachers and 20% of family providers indicated that they are certainly worried about what their family is going to do to be able to afford just general life here in Wisconsin. And we have this high turnover. So it's just a revolving door for children. And that's like the big concern. Also, on top of just, making sure that people have worthy wages, but what is this doing to the children when we have such turnover in most of these places? So that's what's led to our childcare deserts that we've been talking about. And I think we're going to get a little more into that with the next slides.
All right. So up to this point, we've been talking about childcare centers with the ratios and the number of kids in there. We also have family childcare. This is childcare that would be offered in a person's home. And this is just an example of what their revenue and expenses look like. Their occupancy expenses are the most expensive. And at $24,000 in most of our areas, if not all of them, this is also not a living wage for a family childcare provider. When converted to an hourly wage, 49% of providers are making less than $8 an hour. And I will share over the course of the last 2 years, I have worked with numerous providers that are making $1.50 to $3 or $4 an hour when they break out their salaries from the expenses that they have for their childcare business. And they are professionals and they are entrepreneurs and they deserve to have a living wage just like everyone else. So we really want to do what we can to support them. Go to the next, there we go.
So I'll talk a little bit about the rural impact. In my area, I regularly hear of people who are driving upwards to an hour just to find childcare, one way to get them, to drop them off, things like that. They're using multiple providers in our rural areas, maybe dropping off an infant somewhere and then older children somewhere else. We have about 2 years worth of waiting lists. So you have to decide to maybe think about having a child and then get on a waiting list. It's so tough out there right now. So it's a real issue in the rural areas. And part of that, or a big part of that, is the loss of family childcare. So so many of family childcares have either retired out of the business, right? So we had quite a few people that did that type of thing. The pandemic hurt this because you're bringing children into your home. And if you have people in your home that are having issues with other things, then perhaps they, got out of the profession also. And so it's just a really tricky time right now to make sure that we have enough family childcare for rural areas. Most of the areas, or many of the areas in my 10 counties, just can't sustain group childcare centers. It just isn't going to work, as Kari kind of mentioned how that tricky that budget is. And so really the family childcare piece of it is a critical piece that we really need to build back so we have a better infrastructure of childcare. We have an awful lot of families that we talk to that are either going back to the Twin Cities to live because so many are kind of implants a lot of times, but maybe have family in the Twin Cities or closer so that they can have childcare, they can be closer to their relatives and things like that, so they can depend on some of that kind of thing. Or one of the parents are leaving the workforce altogether, so that we have, such a crisis in every other workforce, it seems, where we don't have enough employees. And really, a lot of times we're hearing that every day, that one person is not in the workforce at this time. We do know, though, that 70% of Wisconsin infants mothers are in the workforce, and we have, just such a need for infant care right now. It's really been a tricky situation for a lot of people. We spend a lot of our time explaining regulation and asking people if they have a friend, family, or neighbor that could care for children, because we do have resources in place in some of these areas to make sure that people can get regulated. It's just very tough to find that person that's willing to do some of this right now.
All right, some of those challenges, we've talked about a few of them already, but community growth. We saw a change where families were living over COVID. They were going rural to be closer to parents or others, and then others were leaving because of resources. So that community change, that childcare change. Parents want high quality. They want higher quality. They don't want to just drop their child off somewhere to fit the need for the 9-to-5 job that they have. They want some place where their kiddos are having a good experience, where they're going to be loved and nurtured to be able to be ready for school experiences. We mentioned the early childhood workforce crisis. Family childcare providers are leaving the field, and they have been for decades now. In our childcare centers, providers are not entering the field. That $12 to $14 an hour rate is just not drawing people in. They don't get benefits. They hardly get PTO when they can go to their local Quick Trip or grocery store and make $16 to $18 an hour and possibly have benefits as well. Infant and toddler care requires scale. So our infant and toddlers, because of their low ratios, cost the most. They also have some more equipment and different things, cribs and high chairs. So when we pull out our school age kids or our preschool kids and we put them into separate programming, infant and toddler care is typically not sustainable without outside resources and support. So we really want to be mindful of keeping our age groups together, and so that we can really sustain those programs, because our preschoolers or school agers are typically what balance the scales on the cost of those infants and toddlers. Community perception of childcare. I think it's really changed since COVID, but up until that, you didn't hear too many people or parents going to their HR and saying, hey, I can't come to work today because of childcare. It was a personal issue. It was something that you didn't bring to your employer. So oftentimes we're asking employers, what are you hearing about childcare? And they say nothing. And we're still kind of hearing that in some places today. And I ask them then, are you asking the question? Because as soon as they ask the question, all of a sudden their employees are feeling more comfortable and saying, yeah, childcare is the reason that I was late to work, that I had to leave early, or that I was just not as focused because I'm trying to figure out what's going to happen tomorrow for my child. And then prices are high for childcare. We are talking about parents who are typically at the earliest point in their career, so they're making fewer dollars. Nationally, they say that a person should pay more than 7% of their income for childcare, and no family should pay more than 7%. And there is not a place in the nation where parents are paying less than 7% for childcare. So it's just a total imbalance. And that's where community investment and community support in childcare can really make a difference.
Since Kari just mentioned that we're looking at that 7%, Partner Up is right now changing a little bit, and we just added another grant to it so that we are part of a DWD grant, and we are now not giving free child care like it was when it was just the pilot. We are now looking at about a 7 to 10% that the parent will provide also. So the 3 people are paying for the child care, a little bit of the grant, a little bit of the employer, and a little bit from parents. And we're hoping that that's more of a sustainable situation, and going forward, hoping to be in the governor's budget. We're doing a lot of advocacy, and I feel pretty positive about it. The community need here that we did to identify the local needs. Childcare Partnership regularly does surveys, and this one specifically was done in December of 2022. Group childcare programs, we surveyed them. And the workforce shortage, we had 324 opening teaching positions. We had 590 teachers hired in the past 12 months, 590. I want you to think about that, because I want you to think about little kids who have to transition in and out, right? And this is intimate care. This is not just I'm playing with my friends kind of care. This is diapering and feeding and relationship building that needs to be there in order for children to have brain development, to develop in the most optimal way that we want them to have. 590 teachers is a very big concern. 54 classrooms are closed, meaning that we don't necessarily need to build more buildings. We need to get teachers a worthy wage so that they'll be in those classrooms. Access for family, 90% of programs have wait list, and like I mentioned, it's up to 2 years. We got 90% of programs, or 2,195 children under the age of 3 on lists, and a little over 2,000 over 3 on waiting lists. And it's just a real tough time out there. So the workforce shortage, that's like Western Wisconsin, or that's my 10 counties, the data that I just gave you. Polk, Pierce, and St. Croix. Specifically to that, we have 90 open teaching positions, 164 teachers hired in the past 12 months, 14 classrooms closed. And I know that was December, and I also know that looks a little bit worse now than it did then. And I'm really concerned about the fact that there's a grant out there called Childcare Counts. It is COVID relief money, and it is going to be down to half come this summer, and then it's going to be gone in 2024. So we're very concerned about this data getting worse before it gets better, unless we get childcare counts to stay in the budget. And that is being decided pretty much as we speak. That is what's going on. So access for families, we have 53% of programs with wait lists in those 3 counties, 576 children under 3 and 228 children over 3. So that's specific to the area, I think, that are most concerning to the people on this call. So our 2 main takeaways, not surprising at all, teacher shortage and families struggle to find childcare. So if we figured that if we had full teaching staff hired, we'd have at least 1,500 more slots for children if we could find the teachers that we need.
Oh, that's where you all come into play and your networks come into play with those partnerships. There are a variety of really successful things that we've seen happen with partnerships in the communities across Minnesota and across Wisconsin. Lots of creative things that can happen through partnerships with local businesses, shelters, school districts, nonprofit organizations, civic organizations. And the way that these partnerships can happen is through funding, supporting kids through that true cost of care, like Renee mentioned, where the parents are paying a portion, Partner Up was paying a portion, but we've also seen some businesses come forward that maybe didn't get that Partner Up grant, but they still said, this is an investment worth making. And we will offer our staff, $5,000 for their childcare as a benefit to them to help pay for that childcare and support the true cost of care as well. Space and in-kind donations. If a church or a school or a nursing home or a hospital has empty space, sometimes it's a great facility for childcare to open up in. They already have the space, they already have the heat, the electricity is nothing, so they can provide that for basically free. And as I was sharing earlier, in those 112 seat, 57 seat centers, if they could provide that, get space provided for nothing, right? All of a sudden, their finances totally turn around. There are definitely some considerations that we have to take into play. So if you want to move to the next slide, we do have to comply with licensing rules and regulations. There is square footage space, bathroom and hand washing accessibility that is, needed. And we need to acknowledge that there's outdoor green space for the kids to play, safety and fences and those kind of things. There are city, state, and community ordinances that are also come into play. And I've seen communities change their city ordinances to support childcare. Sometimes it's a zoning issue or minor things that can be changed to help support childcare in different locations. And then, of course, depending on the business type, if it's for-profit or nonprofit. Some of the other considerations that we need to take into consideration as we are looking at partnerships for childcare businesses, if we want to move to the next slide, are the capacity with our childcare businesses. As Renee has highlighted as well, the staffing need is huge. So we don't want to put any more burden on already tapped out staff. Our directors are having to fill spots in classrooms because they don't have enough teaching staff. And without a person in that classroom might not be able to be open. So we have to think about the capacity of our childcare programs. The costs of the materials to develop new programs is also a consideration. Enrollment ratios, attendance, for some grants and other things, we can't ask them to meet biweekly because they're in a classroom. They don't have the time for those things. We can't have extensive reporting requirements and different things for them. Quality measures are also extremely important. What kind of reimbursement procedures come into play? Is it very time consuming for those staff? Do they have the capacity to do that? And then, overall, what is that staffing cost and requirement there? So we have a few recommendations for you all. And being here is so great. Thank you so much for listening to Renee and I today talk about the childcare needs within your community and a little bit about how you can support and advocate for childcare. Understanding that relationship between childcare, communities, and economic development is key. Protect existing early childhood education investments already made. Renee spoke to the Child Care Counts funding. I know many providers that we are working with will be in a very dire situation in the next 9 months if that Child Care Counts funding goes away. They're going to need partners to be able to invest in their childcare programs to be able to stay afloat. So do what you can do to influence those around you, to invest in childcare and create learning experiences for others to understand the link between childcare and the economy. We are so grateful that we had the opportunity to share this with you today. So please continue sharing that message about how local communities members really do have an impact on the childcare within their communities. If employees can't find quality care for their children, they will not work for you. They will not work in your communities. They won't move into your community. They will move away. They might have to consider quitting their job just to stay at home, to be with their kids because they have no other option. So together we can work to help the childcare industry take a turn for the better and becoming that thriving industry that we need it to be. All right.
Okay, well, thank you so much, Kari and Renee, for that excellent presentation and for being here today. Everyone, please type your questions into Zoom if you have them. And I'm going to take a look down from Rick Bonlender, who's very involved in this work. Can you talk about the rapid retirement trend of home-based family care providers and how many childcare educators will be needed in the near future to replace them?
I've been in my position, I've been at Childcare Partnership for over 20 years. And when I began, we had right around 1,000 providers. We now have in my 10 counties, right around 300, a little over 300 providers. Much of that is group center. Much of what we lost was family childcare. And that is a big part of what we need to rebuild in these rural areas so that we have enough care. I don't have specific numbers, but I can tell you that 300 childcare group right now is not enough. So we need hundreds in my 10 counties in order to make it a viable option of family childcare. And yeah, that's kind of where we're sitting right now.
Okay, this is also from Rick, and I think I have the same question. So how do you explain to households without children that childcare and early child education is an issue that is critical to them and worth their support and investment?
Right. Childcare is important to the family, obviously. It's important to the employer because he needs them to make sure that they can get to work. And it's also important to the economy so that we can keep workers working, right? So I would say that if we want to have an economy that's thriving in Wisconsin, we certainly need to provide that childcare so people can get to work. I think that that's, like it's a community problem, way bigger than just the family who's struggling.
Absolutely. Now that more people are working from home, has that changed the landscape, the childcare landscape? Are you seeing any changes there since COVID?
Not really. you know, you might be working from home, but if you have to drive an hour to put your child someplace, you know what I mean? Like it doesn't, because you're not really caring for them at home, because that's a tough, you know, thing to kind of navigate. So I don't really see that that's helping too much. I am seeing a little bit of families trying to get together. Like if you're all in the neighborhood, there might be spotty kind of care happening for part days and things like that. That's different than what we've seen before. But truly in my rural areas, people are driving to find childcare where they're looking at whether they're working at home or not.
Yeah.
Yeah, I would agree with that statement. You know, parents maybe thought right away, oh, I'm working from home, I can keep my kiddos. But the reality is when you have those early and young children that are not school age, the productivity just goes way down and it's just not the most feasible option. So they are driving, like Renee said, an hour to drop their kiddos off, and they are still needing that high quality care.
Okay, and Renee, I think we're all curious to know what's going on in Washington, D.C. Judy asked, at what point does this become a policy issue? And who are the advocates and the lobbyists?
So there's money called the Childcare CCDBG, Childcare Development Block Grant. Comes in from the federal government, and that's what we're here to advocate for. More investments made in that, so that there's more dollars coming into the state. So I think that's what I'm doing here today. You know, to be quite honest, we're finding that there is some pretty good bipartisan involvement in this issue. Certainly, I mean, we met with, I think, isn't there somebody from Tammy Baldwin's office on perhaps today? We met with people, Becca from her office yesterday. There's a lot of support from her office in looking at this. And that's a big part of that's who wanted to know a lot about the Partner Up pieces and to see what that program was doing and things like that. So I do feel though that I met with 5 different people yesterday from both parties, and both were very well educated that there was a problem and that there are certain things that they want to do about it. We also testified at the Joint Finance Committee when it was in Wisconsin to make sure that people were aware of what was going on. We've gone to listening sessions. We've just really been out there as a network to really make sure that Child Care Counts is taken care of, Partner Up, and some of these other tax incentives that they're looking at too. So I feel like we're well received. I just also feel like, you know, it's a big budget ask. And so, yeah, it's anybody's guess what will happen here.
Okay. So acknowledging that is in the works and hopefully headed in the right direction.
Mm-hmm.
What to do in the meantime to get people thinking outside of the box? Have you seen some really creative approaches in community that you could highlight for us?
Yeah, we've definitely seen some really creative things happening across the state of Wisconsin and in Minnesota. As I mentioned, some partnerships with space and businesses coming forward, recognizing at this time that penalizing staff for being 5 minutes late and those kind of thing only creates a little more stressors. So working with families to understand their childcare needs and how a business can support that. Investing in your current and your local childcares. We recently had Week of the Young Child. It's Teacher Appreciation Week. Businesses coming together to support those providers that are in your local communities through advocacy and acknowledgement, recognizing that their profit margins are slim. Is there something that your business can do to invest in that local childcare? It might be time. If you're an accounting firm, can you help invest in a childcare by offering your services at no cost to them? Can you provide space? Maybe you manufacture something that they could utilize. Maybe you distribute cleaning supplies that you could donate to childcare programs. There's a lot of unique ways and a lot of unique things that our childcare programs need, and businesses can partner with them to support that.
Okay, and I'd like to point everyone to Allison's comment in the chat, because that is what we're working towards. Yes, that's what resiliency is all about. What if Wisconsin, and we'll add Minnesota, were the best place in the country to raise a family? So I think that's what Renee and Kari and many that are a part of this call are working towards. So thank you for those thoughts. Rick asked, are there studies that we could access that have compared student success later if they had that quality childcare? Is there research out there that we could access?
Yeah, there are. I'm not coming up with any of them off the top of my head, except for the Perry preschool. That's the one that really bubbles up with me. There's another Harvard one. Kari, do you remember that? Yeah, I don't have them on the top of my head, but yes, there are quite a few of them. Yeah, I can't bring it up when I'm sitting in an airport looking at other things, right? Like too much going on here.
Yeah, the Perry preschool study was one that came to my mind first, and that talks about the investment in early care and how that makes a big difference in the long term. The Federal Reserve out of Minneapolis has also done some studies on the economic impact of childcare. So there are definitely some great studies out there on childcare economic impact in communities.
Okay, thank you for that. And obviously you presented some grim facts and data today. Where do you feel you're feeling the greatest hope?
Well, right now, locally, we have some grant opportunities. So we have Wisconsin Early Childhood Association, who has written for a grant that will allow family child cares to get up to $10,000 and group centers to get up to $40,000. As a pre-licensing agency, we have seen a nice uptick because of that in our 10 counties. So I have typically right now, I might have 12 to 15 providers that are looking to start childcare during the summer and into the fall. Right now, I have almost 30 on my list that I'm working with to hopefully start some more childcare. So I feel like that's really a positive turn. Also in the St. Croix Valley, we are doing a mentoring program where we take existing childcare providers and we're mentoring, and they're bringing on new ones and mentoring them. And so right now we have in the works 6 to 8 of them that are all partnered up and ready to go. And so we should have new childcare spots that have to do with family childcare right now. So there are some really good positive things happening. It's just that, I just want it to be solved a little quicker. Patience is my issue.
Yeah, I would say these conversations, for the first time, conversations around childcare with local businesses, entrepreneurs, and community leaders, these conversations around childcare have not happened in the past. And I think that's a great starting point. I'm like Renee and want it to happen faster. But when we look at how communities can work together, and they are working together across Wisconsin, across Minnesota, to support the childcare businesses, I think that's really exciting, because for the first time, communities are working together to address this issue. So continuing that momentum is also really, really exciting.
I would agree with you. I just spoke at a workforce development summit, and the number one thing that came up when they asked a question, they were supposed to put their answers in so that it would go up on the screen for a bunch of HR people and employers. And the biggest word was childcare. And that just means so much to me that we're having these conversations and that people are willing to come to the table. With the Partner Up work, we're primarily working with small businesses to do that. But we have had very large businesses reach out that would basically take all the slots. So we're unable to do that at this point. So we do have some really good momentum doing this public-private partnership work.
Okay, and I just want to point people to the chat. I dropped my email address in the chat. If you're wondering how to connect to this topic, how to connect to this work, please feel free to email me and I will do my best to connect you to those in the trenches. And with that, a huge thank you to Renee from Washington, D.C. for joining us, and to Kari for being here today. I also want to thank our sponsor, First State Bank and Trust, and of course, the COV Planning Committee. And this concludes this year's COV series. Please keep an eye out next week for a survey, which you will receive via email. That will really help inform our planning committee's decisions about next year's program. So we appreciate in advance your participation. And of course, if you have any thoughts, comments about today's program, or if you'd like to learn more about the St. Croix Valley Foundation, please feel free to reach out to me. Call me or send me an email. Again, I thank you for being here today and for being a part of these really important community conversations. It was great to see you. Thank you.